Thank you so much for taking some time today to learn about what we're doing at Health Corum and how you can leverage data-driven processes to best optimize your provider networks. My name is Keith Summers, and I'm a co-founder and director of business development here at Health Corum. Online, we have Murat Altman, co-founder and chief information officer at Health Corum. Murat has over a decade of experience working on AI applications and implementing machine learning for various use cases. I would like to take this opportunity to give thanks to our advisory board members, Kathy Eddy, Tracy Dodenhoff, and Ewan Amigi, for their help in making this event a success. Over the next few minutes, I'm going to give you a brief overview of why optimizing your provider networks is so important and what you can do to capitalize on a goldmine of opportunity to improve outcomes. I'll also share some examples of how this all manifests in real-world examples. Our goal is to leave sufficient time for Q&A at the end, so please submit questions through the panel on your right, and we'll address as many as possible. Without further ado, let's dive into it. Health Corum was founded in 2016 with the mission to eliminate much of the low-value healthcare spending that currently exceeds $1 trillion annually in the U.S. Our flagship platform retrospectively analyzes de-identified claims using its proprietary relational rule sets and AI-based pattern matching algorithms to create a series of risk benchmarks. Using these benchmarks, healthcare organizations can identify and quantify low-value care being delivered by their providers. I'll get into this in greater detail shortly. However, first I'd like to outline what we see as challenges existing in the space today. Payers, providers, and patients alike must deal with the seemingly ever-changing healthcare landscape. Rates, which continue to eclipse all other developed nations globally, are again at all-time highs. In 2019, the cost per covered employee exceeds $15,000 annually. Can moving away from fee-for-service, volume-based care to value-based care be the answer? We believe so. As does the government, with the introduction of the Affordable Care Act, has created new incentives and corresponding penalties to effectively manage risk. Case in point, health insurers are expected to pay out a record $743 million this very month to consumers as a rebate for underspending premium dollars on actual health care. How will insurers make up for such a massive hit to their bottom line? Then there's the provider perspective, with 70% of physicians preferring to remain in a fee-for-service model. They cite difficulty in delivering high-quality care with a complex regulatory environment and increasing administrative burdens as they attempt to navigate a more difficult reimbursement landscape. Yet time and again, doctors acknowledge that cost is generally not a key factor when deciding which treatments to prescribe. One thing all parties can agree on is that healthcare is far too expensive and something needs to be done. Unfortunately, most organizations are underprepared for the shift to value-based care, and as a result, end up wasting precious time, money, and resources, ultimately defeating the purpose. It begs the question, how can you maintain quality and make money in a changing environment? At Health Corum, we believe the answer lies in improving risk management. While existing efforts that focus on clinical edits, audits, and recovery have shown returns, they only look at a fraction of total spending. Remember the $1 trillion in unnecessary low-value care I just mentioned earlier? Well, by optimizing network performance as a risk management technique, you can reduce up to a whopping 30% of all spending. In addition to cost savings, the process encourages better communication between providers and payers, as both parties have clear objectives to strive for. This is why we made it our company mission to uniquely focus on developing a proprietary methodology to identify and reduce the delivery of low-value care. Here's a look at the key modules of our flagship platform, Corum NOW. There are a multitude of use cases, such as expanding into new regions or creating brand new networks. For today's presentation, we are focusing on optimization process of an existing network. The client begins by submitting a list of MPIs to our technical team, which are then verified for accuracy. The verified list is uploaded to the Corum NOW platform, and an initial report is generated recommending ways that the network can be optimized, either by changing problematic practices or replacing certain providers altogether. Our clinical team then applies an extra layer of validation to ensure that all recommendations being delivered are accurate and feasible. Finally, a formal report is delivered to the client outlining the network optimization steps and strategy. As for the underlying foundation of the technology, the platform begins by processing a massive amount of public and private data, including de-identified claims data on over 1 million providers nationwide. It's architected to operate as a standalone dataset, while also including the flexibility to ingest client data when appropriate. At its core, the technology generates an overall score for each and every provider or group practice. Scoring is templated out of the box with equal weights for pharmacy, clinical efficiency, and procedure, which each have their own underlying metrics that are tailored to specialty. For example, the underlying metrics for cardiology are different than for orthopedics. We apply relational rule sets and AI-based pattern matching algorithms as a central tenet of our scoring methodology. It's a big part of what makes Corum so unique. The key here is that we are creating a true apples-to-apples comparison where each provider is objectively benchmarked against comparable peers. Insights and analytics are then made available on the front end of the platform and incorporated in project-based reporting. So now that you've had a chance to see how Corum approaches network optimization, I'd like to explore a real example for context. Here you're seeing how today's evaluation process might look when an organization is comparing two providers who on the surface appear to be very similar. Specialty, geography, education, outcomes, and a slew of other high-level indicators are often used to make these critical network decisions. But none of these common indicators do a good job of determining how the providers compare to their peers from a cost efficiency perspective. With an evaluation process powered by Corum, networks have access to variance-based indicators that have significant impact on their bottom line. Dr. A and Dr. B both have similar patient populations and risk factors, but upon careful review, Dr. B has been flagged for delivering a pattern of low-value care. He jumps quickly to expensive procedures, and prescriptions are not cost-effective. We also detected a conflict of interest based on what he prescribes and monetary incentives he has received. There's a lot more to provider performance than meets the eye, and it takes deep analysis to truly uncover. I've now mentioned low-value care quite a bit. It's care that may be clinically appropriate, but unnecessary, and provides little to no value to the patient, often while carrying these additional risks. Here's a closer look at a pattern of low-value care we detected when analyzing Dr. B from the previous slide. Again, he's being compared to his peers when treating similar episodes that carry similar risk. Looking at the numbers, we compare how often Dr. B performs total knee replacements relative to the less expensive alternative, arthroscopic knee surgery. He chooses the more expensive TKR 55% of the time in comparison to his peers, who choose TKRs only 35% of the time. If Dr. B adjusted to practice at the peer average, he would perform 30 fewer TKRs annually, yielding a cost reduction of $1 million. And that's just one doctor performing one type of procedure. Imagine the massive savings opportunity when this type of scrutiny is applied across an entire network. And here he is again, Dr. B. In addition to a pattern of low-value care, we detected a potential conflict of interest with two products he prescribed heavily between 2017 and 2018. Combined, Dr. B received more than $236,000 from the pharmaceutical companies behind Humira and Otezla. He then prescribes more than $284,000 worth of those medications to patients. Now, we're not definitively saying that the money he received impacted his prescribing patterns, but based on the evidence, a scenario like this is certainly worth a closer look. Ultimately, all of our client engagements will yield a series of deliverables based on project scope. A very basic evaluation contains scores for each provider or grouping evaluated, while a more advanced evaluation reveals granular insights such as detailed explanations of low-value care and conflicts of interest. In addition to these very targeted projects and use cases, Corum Analytics can be accessed on demand at any time through the Corum NOW platform. Simply choose a geographic region and begin researching providers and social factors for that location. Looking to increase network coverage for an underserved chronic disease? Corum NOW gives you the tools to perform a comprehensive evaluation at any time. Earlier, we discussed the myriad of challenges facing healthcare organizations today. Fortunately, there's a number of ways that we can help. With Corum, you can achieve better savings, form closer relationships with providers, identify new network additions, relieve strain on internal resources, improve quality scores, and reduce network leakage. It's also a powerful tool to differentiate in a competitive marketplace. The end result? Healthcare organizations can reduce their medical expenditures while patients receive the right care at the right cost. As a thanks for listening, I'd like to offer the opportunity to experience the advantage for yourself. Send us 10 MPIs for a free sample evaluation and begin the process of improving your risk management strategy today. With that, I'm going to begin the Q&A portion of our meeting. Thanks for listening just now. Appreciate it.